helping people cope with and overcome life's challenges. This is Life Transformations with Michael Hart, Canadian certified counselor and award-winning psychotherapist.
Thank you for joining us in this episode of the Life Transformation Show. Today's show is titled Psychotic Disorders Caused by Alcohol Use. Yes, most of us are aware of the problems associated with alcohol when it comes to effects that it has on our relationship. We also know of the violence associated with drinking alcohol. Many of us have this concept of the angry drunk. We're also aware of the tragic losses that's caused by drunk drivers and the health effects associated with alcohol use. However, many of us do not know of the serious mental health risks associated with drinking alcohol. In today's show, Psychotic Disorders Caused by Alcohol Use, I will be underscoring the serious issues associated with drinking alcohol when it comes to our mental health. I am talking here about serious psychotic-like symptoms that can be caused by drinking alcohol. Symptoms similar to those experienced by people with schizophrenia. I will speak more in detail later on about the symptoms of the psychosis that's caused by drinking alcohol. But let me briefly here explain what is a psychosis for listeners who might not be familiar with the term. A psychosis is a mental health state in which a person's perception of reality becomes distorted. And as a result of this distorted sense of reality, many people who suffer psychosis need antipsychotic medication and other treatment to correct their faulty thinking. Many people who suffer from psychosis may need to take these medications for the rest of their lives. So when it comes to psychotic disorders caused by alcohol use, we're talking about very serious mental health disorders here. And I think that in the same way that we have billboards that warn us about the dangers of driving drunk, I think there should be billboards and ads that warn us about the serious mental health conditions that can result as a result of drinking alcohol. Many of you listeners who are familiar with this show will know that I will use a biblical passage to illustrate my point. Well, today's show is no different. It appears to me from reading the book of Proverbs that the writer of the book of Proverbs, that many believe to be King Solomon, had a very good grasp of the seriousness of drinking alcohol. Let us note his words that we find in Proverbs 23, verse 31 to 34. And as you hear me read these verses this morning, I want to see if you can see the mental health component that the writer here is zeroing on by the use of his words. Quote, "Do not gaze at wine when it is red, when it sparkles in the cup, when it goes down smoothly. In the end, it bites like a snake and poisons like a viper. Your eyes will see strange sights, and your mind will imagine confusing things. You will be like one sleeping on the high seas, lying on top of the rigging." Did you catch the phrase in that passage there that captures the definition of a psychosis? It is the line where he said, your mind will imagine confusing things. There is a lot here in the other things that are here in this passage that I will elaborate on later on. But for right now, just let us keep that in mind, that the writer of Proverbs is saying, when you drink alcohol, it has this effect on your mind where you will become confused, where your mind will imagine confusing things. So as we go through this show today and we talk about psychotic illnesses caused by, or psychotic disorders caused by alcohol use, you will see that the writer of Proverbs was bang on. I'm going to be highlighting several symptoms that you can look for to see if you might be suffering from a psychosis, or someone you know might be suffering from a psychosis as a result of drinking alcohol. But I will also be talking about who is particularly at risk. There's a certain demographic of people who drink alcohol that is at risk for having a psychotic disorder. And I also want to be talking a little bit about what are some of the things that you can do if you or someone you know is having a psychotic disorder or is suspected of having a psychotic disorder as a result of drinking alcohol. And I think this knowledge is crucial because taking these steps can prevent a person from developing a serious mental health disorder as a result of their alcohol use. So let me start first by just explaining who is at risk for alcohol-induced psychosis. Firstly, people who drink large amounts of alcohol in one sitting is at high risk for this disorder. People who binge drink. So it could be a one-time sitting where someone is having alcohol for the first time and they're drinking large amounts of alcohol. If that's the case, this person is at risk for a psychotic disorder as a result of their alcohol consumption. The point I'm making here is that you do not have to be an alcoholic to have a disorder, a psychotic disorder as a result of alcohol use. It can be as a result of binge drinking, even if that drinking is your first time consuming alcohol. And yes, the second category of people who are at high risk for developing a psychotic disorder as a result of their alcohol use is people who are alcoholics. If you are an alcoholic who is drinking regularly and frequently become drunk, it is possible that you could have a psychotic disorder. You could develop, I should say, a psychotic disorder as a result of your alcohol use. And the third category of people who are at high risk for developing a psychotic disorder is people who start drinking, who is using alcohol at a young age while their brain is still developing. If you are an adolescent or you're a young teenager and you're drinking alcohol, you could be at risk for developing a psychotic disorder as a result of your alcohol use. And the fourth category of people that is at high risk for developing a psychotic disorder as a result of their alcohol use is if you have a family history of alcoholism or mental illness in your family. So there you have the different categories of people. So what causes alcohol-induced psychosis? What is the cause of someone developing this disorder? So while it is not clear exactly what causes this disorder from alcohol use, some studies suggest that alcohol-induced psychosis is a result of the impact that alcohol has on the brain's neurotransmitters. And as a result of that effect on the neurotransmitters, the person who is drinking alcohol develop a psychosis or has a psychotic illness or psychotic disorders. There are some other studies that shows that alcohol may disrupt certain neuroreceptors, and that this disruption of certain neural receptors plays a role in a person developing alcohol-induced psychosis. So what are the symptoms? Let's get right into the symptoms, because this is very important. If you are someone you know is drinking a lot of alcohol, or as I said, binge drinking from time to time, it's important to be able to spot the symptoms that might show that a person is on the verge of a psychotic disorder. One of the first signs that you should look for is a person who develops jumbled or disorganized speech. Well, you said, Michael, isn't that typical of every person who becomes drunk? Yes, that is the case. But what I'm talking about here is a symptom that continues even long after the person is no longer in this drunken state. If you see that there is a persistence of disorganized speech or jumbled speech, the person is saying a lot of things, but it's just not making any sense. So you may ask them a question and they attempt to answer the question, but the answer that they're giving you just does not hit the subject that is at the heart of what you're asking. This could be a sign that the person is having a psychotic break and is on the verge of developing a psychotic illness. One of the hallmark features of alcohol-induced psychosis is delusions. Persons who are developing serious psychotic disorder from alcohol use often have delusions. It can be delusions of grandeur where they think that they are somebody famous, or it may be of a spiritual nature where this person might think that they're an angel or that they're the return of Jesus Christ. And people, when they're in a psychotic state and they're saying these things that to you don't make sense, they really believe it. And so, again, I'm not talking about here someone who is just drunk and has after a night of drinking and is saying these things. I'm talking about a situation where these beliefs persist. If you see this happening, it could be an indication that the person is having a psychotic disorder as a result of their drinking. Another sign that you can look for is if this person starts laughing regularly or crying inappropriately. These kind of behaviors could be a sign that there is something happening inside the mind where the person is losing their grip of reality. So it's very important to pay attention to these symptoms. Another hallmark symptom of alcohol-induced psychosis is hallucination. And hallucination can take three forms. Hallucination can be tactile, where a person may believe that they are being touched or they have a sensation that someone is touching them, but you see no one and there's obviously no one touching them, or they feel that there is something crawling on their skin, but you can visibly see that there is nothing on their skin. This could be a tactile hallucination. Hallucination can also be auditory, where this person might be hearing voices that is not audible to anyone else. So if a person is talking about having sensations of being touched by someone or having auditory hallucination, hearing voices, it could be a sign that they're having a psychotic illness. And also there's visual hallucination as well, where people who are having a psychotic illness sometimes speak of seeing things that no one else sees. They might see someone in their room or someone who is long deceased, and it's just not visible. It's just not the reality. And so if you see a person having hallucination, pay attention to that, because don't just brush it off as a strange behavior that will pass, because this could be a sign that a person is having a psychotic illness. And another sign is agitation. The person is agitated. They can't sit still. They're restless. This is another crucial sign. And so if we go back to the scripture that we read earlier on from the book of Proverbs 23, where the writer of the book of Proverbs talk about the effect of alcohol. And the author there says something that's very, that captures this point, where the author says that not only will the person see strange sights, but they will be like one sleeping on the high seas and lying on top of the rigging. Now, the rigging refers to the mast of the ship, where you have the sails, and the sail is flopping about in the wind. The sail is restless. The sail is agitated. It is moving by the wind in high seas. And so what the author here is saying in by way of using that analogy is that a person who drinks alcohol can become agitated. Someone who is sleeping on the mast of a ship is not going to be resting peacefully. They're going to be agitated. They're going to be restless because of the noise of the sail and the flapping of the sail in the wind. And so people who are having a psychotic illness often shows this sign of restlessness or agitation that the writer of the book of Proverbs talk about. And so if you see this, it could be a sign that the person is having a psychotic illness.
Michael will be right back. You have been listening to the Life Transformation Show, where award-winning psychotherapist Michael Hart of Elim Counselling Services has been using Proverbs 23:31-34 to speak on the topic, Psychotic Disorders Caused by Alcohol Use. You can find out more about us at elimcounselingministry.com, where you can also make a donation to this Christ-centered ministry. Your donations help us to stay on the air and to provide subsidized counseling to those who can't afford it. Back to Michael.
Another thing that you should look for is if the person displays fear and paranoia. So a person who is on the verge of a psychotic break or having a psychotic break as a result of drinking will sometimes become paranoid, and they will see things that is troubling to them, and they will perceive things that is not real. So they may think, for example, that the RCMP is following them around, or that the CIA has some kind of device wired into the walls of their house that is listening to their conversation. Or it might just be that the neighbor next door is talking about them, and they might feel that they can hear the neighbor's voice from 500 meters away, or from across the road. And it's just not true because no one else is hearing that. But this is a sign of paranoia. It can be paranoia to the person that they're in a relationship with as well, where they become convinced that the person is having an affair. Someone who is trustworthy and loyal is suddenly being suspected of having an affair. If these things are happening to someone who has consumed alcohol, it could be that the person is having a psychotic break. Another thing that you can look for is change in the person's interest. If this person is just no longer interested, suddenly no longer interested in their favorite leisure activity, then it could be a sign that there is something shifting inside the brain and that they might be suffering, this might be a symptom of alcohol-induced psychosis. Other things that you can look for, and I'll just go over these quickly because I want to get to what to do if you notice this happening. So you can also look for a person if they demonstrate lack of self-care, they're not taking care of themselves as before, such as brushing their teeth or, having frequent baths or trouble completing daily tasks or other inappropriate behavior, or suddenly becoming angry, upset, or energized for no apparent reason, or loss of energy and motivation. These could all be symptoms that the person is having a alcohol-induced psychosis. So now what do you do if you notice that someone you love is having some of these symptoms after consuming alcohol? It's important to know what to do, because the prognosis is good if certain steps are followed. It says, but however, what we should know is that although the prognosis is good, the studies say that 10 to 20% of patients with alcohol-induced psychosis will develop a chronic schizophrenia-like syndrome. And so this is a very serious issue. So you're talking about here schizophrenia-like syndrome that could last a long time. And 10 to 20% of people suffer this who develop alcohol-induced psychosis. So here are some things that you could do to minimize the risk of this happening if you notice the symptom. The first thing you should do, if you or someone you know is showing any of these signs, is to, if it's you, stop drinking alcohol right away, or advise the person to stop consuming alcohol if they start showing any of these symptoms. Because the studies show that continued consumption of alcohol after showing these symptoms will lead to a deterioration in the person's mental state. The second thing that you should do is to go with the person to their health professional. And this is very important because alcoholics tend to underreport the seriousness of their drinking. And so maybe this is out of shame. There are some people who are well known in business community, for example, who find it very shameful to admit to their doctors that they have a problem with consuming alcohol. So what these people will do if they are showing signs of psychosis and they go into the doctor and the doctor starts asking them questions about their alcohol use, they will minimize the extent to which they are drinking. And so if you present the doctor with incorrect information, then the recommendation or the advice or the treatment that the doctor is going to be prescribing is going to be compromised. And for that reason, I believe that the incidence of alcohol-induced psychosis is actually much higher than what the studies show, because many people who are alcoholics or who consume alcohol tend to minimize the extent to which they are consuming alcohol. So if you have someone in your family who is demonstrating any of these symptoms, it is important to accompany them to the health professional. And this might seem like an invasion of their privacy because this person is an adult, but if you're a family member and this person know that you have their interests at heart, you can talk them into going with them. And you can even have them sign a consent to release information with their physician so that you will have the permission for the doctors to talk to you about their diagnosis and what is taking place in their treatment. But this is something that they have to agree with. And so stop consuming alcohol right away. Get help. go with them to the health professional and get help immediately, because the studies show that if you don't get help immediately, the chances of developing a chronic schizophrenia-like syndrome becomes greater. And so this brings me to the next point of the difference between knowing whether or not your loved one is developing schizophrenia or if it's alcohol-induced psychotic disorder. Now, there's some differences between the two. And so one of the difference in how you can tell if it's schizophrenia or if it's an alcohol-induced psychosis is that for schizophrenia usually happen earlier in life. So people who develop schizophrenia usually don't have schizophrenia before age 12 or after age 40. But for people who have this alcohol-induced psychotic illness, they can have it earlier or they can have it much later in life. So for people who are consuming alcohol, it can even be in their retirement age. And so if a person in their 50s or 60s starts showing these symptoms, it's a good guess to say that they're not having schizophrenia, but they're having a psychotic disorder that resembles schizophrenia, because the symptoms that I just explained here is very similar to that of schizophrenia. But another difference between alcohol-induced psychosis and schizophrenia is that people who are suffering from an alcohol-induced psychosis tend to show more signs of being depressed and anxious than your typical schizophrenia case. And so there you have some of the differences. And so I think it's important for us to take this very seriously, because as I said before, if treatment happens at the right time, the prognosis is very good. So if you or someone you know identifies with any of these symptoms, do not delay. Get help as quickly as possible. So we have quickly come to the end of today's show. And I want to thank you for being with us on this episode of the Life Transformation Show. I want to remind you that we are on the air every Monday morning at 9:30. If you're listening to this show via our YouTube channel, remember to subscribe, because doing so help us to get the word out to others. If you're listening on air and have missed parts of this show, you can listen to it in its entirety by going to our YouTube channel. The shows will be uploaded within a day or so of this on-air broadcast. If you would like counseling for any mental health or couple-related issue, we can be reached through our website, elimcounselingministry.com. Elim is spelled E-L-I-M, counseling with 2 L's, ministry.com. We also want to ask for your support, your financial support, so we can continue to produce podcasts like these and continue to offer our unique brand of Christian psychotherapy. So until next time, this is Michael Hart, your host, praying that God will bless you in all your relationships and keep you sound in mind and pure in heart.